So without further ado, Dr. Weinberg, welcome.
Thank you, Lori. I'm very excited to talk to the group. And yes, I hope, as I said to Lori yesterday, that I will be informative, but also provocative. And I encourage questions, whatever type. Let's see, Lauren, why don't we go to the first slide? Okay. Yeah, so I'll give you a little bit of a background on myself. I actually did a residency in internal medicine many years ago, and then at LA County in Los Angeles, and came back to New York to do a fellowship in psychoneuroimmunology. I was very interested in looking at mind-body interactions. This was in the 80s. And unfortunately, one of the studies that I was trying to do then, looking at treating AIDS patients with acupuncture, when I started signing up my first patients, was sabotaged. And I could see that the kind of provocative work that I wanted to do at this fellowship was not going to happen. So I, having moonlit in the ER at LA County and also at the Manhattan VA, where I was doing this fellowship, I knew that Louis Goldfrank, who had started a residency program in emergency medicine, he founded the Poison Center. I knew he was looking for doctors. I needed a job. And so I started working there, not thinking about the fact that I would be an emergency medicine doctor, board certified 3 times for 32 years. But that's what happened, and it was an exciting career. But as everybody can imagine, after doing it for X number of years, there's just such a burnout. And what happened is that 2 of my fellow ER doctors, right when the law was about to be passed, this was in 2015, to legalize medical cannabis, we talked about starting a group. We were all very excited about getting involved with medical cannabis. And I have to say, being a child of the 60s, I certainly had experience with cannabis, but it was recreational, and I really did not know the amazing benefits that the plant could offer. And so it's really been a great journey for me. And interestingly, I feel like now I'm almost in many ways back full circle to what I started with the research, because I think there's a lot of mind-body interactions that cannabis actually facilitates. So it's interesting to me that all these years later, I'm sort of back where I started. Anyway, what I'd like to talk about is a little bit about the history of cannabis, because I think most people don't know how prevalent cannabis has been, the plant, cannabis and hemp, which are pretty much the same plant. You could, if you looked at them, you wouldn't be able to tell the difference, but they have been around for millennium. I think we've really evolved with the plant. And I'm sure everybody knows Carl Sagan. He was a major proponent of cannabis, and he believed that cannabis actually brought us from a society of hunter-gatherers to an agrarian society, because the plant had so many different benefits and properties. You couldn't be out in the desert or the fields or wherever hunting and gathering. You really had to settle down in one place so you could plant it, so you could grow it, so you could harvest it, and then you could take advantage of the various properties that it had. Is that true? We'll never know. I think it's interesting speculation. But again, as this slide talks about, there are just so many places across the world where, if you look, you can see that cannabis and its various, the seeds, the stems, the oil, have been used forever. And I will just mention something interesting also that I've come upon, is that apparently when the first temple was being built in Jerusalem, there was something that says that the priests were supposed to be anointed with an oil made of cannabosum. Is that cannabis? I don't know, but I think it's interesting. I have a friend who's a rabbi and a moil, as well as a physician, who believes that the burning bush was actually a cannabis bush. Again, we'll never know, but I find it interesting to speculate about all those things. Okay, we can move on to the next one. So I think something also very important to know is that cannabis was part of the US pharmacopoeia. In other words, it was accepted as a medicine for hundreds of years, and it was only in the 1930s that it actually was taken off. The Marijuana Tax Act was passed, and all of a sudden, cannabis was no longer an acceptable medicine to be used. And Lauren, just go ahead. I want to see the next slide, what that is. Yeah. So what happened is that, and I think it's important to realize this because so many people, I think, there's so many myths and there's such stereotypical thinking about cannabis, but it's only been for like 80 years or so that it really has been so demonized. And what happened was, very quickly, William Randolph Hearst, who the newspaper magnate, had vast tracts of land with forests that he wanted to use for pulp for the papers. And it turns out that hemp pulp is cheaper and much more user-friendly generally. Also, DuPont in the 30s had just come out with nylon, which they wanted to use for rope. Hemp rope has been around for hundreds of years. So they were threatened by cannabis. They started the Federal Bureau of Narcotics, started by a relative of the DuPonts. And that was when they stopped calling it cannabis and started calling it marijuana, which, all of a sudden it associated with people of color. And that was also when the movie Reefer Madness came out. I don't know if anyone has seen it, but I think it's one of the most damning but persistent propaganda films that's ever been around. People still think of it as the killer weed. And in the 5,000 years that we know that cannabis has been around, nobody's ever died from it. So anyway, coming up more to the present, in the late 60s, Richard Nixon was president. He was very concerned about people of my generation smoking roofer, as he called it. And he appointed William Schaefer, who was the governor of Pennsylvania, to make a commission. He was sure that Schaefer would say, oh, make it illegal. Schaefer actually said, no, I think it should be legalized, which Nixon wasn't happy about. This was the same time that the Controlled Substances Act was passed and the DEA went into effect, where they scheduled drugs, Schedule 1 through 5. As an emergency physician for many years, I have a federal narcotics license, Schedule 2 through 5. So I could prescribe you amphetamine, cocaine, any kind of opiates. I do not have a Schedule 1 certification, and marijuana was made a Schedule 1 narcotic, which has really hampered so many things, banking, et cetera, for the last 50 years or more. And luckily, in the last 30 years or so, a number of states have legalized it, and now we're moving in the right direction. In fact, as I was in the car today, I heard that they're trying to pass a banking act to allow companies that are in the cannabis space to have access to the banks. This is in the Senate. Actually, Steve Daines, who's a Republican from Montana, is trying to get this passed. So it's interesting, the politics and what has sort of evolved. Anyway, I think we can go on to the next slide. So this is a typical marijuana plant. Again, if you look at this, this could be hemp or marijuana. The only real difference is that the hemp has less THC in it, which I'll talk about in a minute. But again, you can see why ancient cultures would have used this plant. There are so many different properties that are available to someone who grows it. And in fact, now people are starting to use it for building materials, the stems. People are using it for juicing. The seed oil, as I show, food, paint, varnishes. And then, the most important thing to me as a physician is the medicinal qualities. But it's also been involved for spiritual rituals and for pleasure. And I think, we are such a straight society. It's okay for people to use alcohol for pleasure, but for some reason, cannabis, it's not okay to get high with cannabis. But again, I think that's changing a lot. And a lot of my patients, I have to say, when I see them, some of them are end of life. I have a lot of cancer patients, even patients with Alzheimer's and other dementias. They feel better, just generally feel better. That's that pleasure part of the plant. And I think that I'm really happy that we seem to be moving in the direction of being much more accepting of that. Okay, I think we can go on to the next. So the plant itself has hundreds of different chemicals in it. And, I won't go into all of them. There won't be any tests or anything, but there are all the cannabinoids, and I'll show a picture. THC and CBD are the ones that probably most people know about, but there are many, many others, like 100 different cannabinoids, which are very, very similar in structure, but have very different effects. And then terpenes, which I think are important just to mention because I'm sure most people at this talk have heard or have smelled cannabis, and it has different smells. And it's really the terpenes that give it the smells, but also that give the distinctive there's something called the entourage effect, where the different components of the plant work synergistically to give different effects. And just an example of terpenes is like if you cut a lemon, limonene is a terpene with a very distinctive smell. You walk through a pine forest, pinene. It's used for pine sol and other things, but they combine in very specific ways to give different effects. In fact, that's really the difference between indica and sativa. And I can talk more about that if people have questions, but those are two major strains that if you either go into an adult use facility or a medical facility, they will be talking about indica and sativa, and it's really because of the terpenes that make a distinction there. Okay, let's move on. So again, the two major components of the plant, and when you go into a medical dispensary, what you will be looking at are THC and CBD. CBD will be next, but you're really getting a ratio of THC and CBD when you go in. And as a physician, what I like a lot about the medical program in New York is that it's very precise and it's really consistent. So let's say you get something, because you can get something, excuse me, that's a high THC to low CBD, something that's equal amounts of THC and CBD, or something that has more CBD than THC. And when you get that particular component or ratio at a dispensary, it's going to be precise, there's going to be the exact amount, and it's going to be consistent. So every time you take that particular preparation, you're going to have the same effects. And in fact, when I talk to patients, especially patients who are what we call cannabis naive, who have never used cannabis before, or maybe used it in the 60s, I tell them to take notes because it really is consistent. And I find that the patients who do the best are the ones who try different products, different ratios. You're always starting, again, at the lowest amount. The saying is start low and go slow. But when you take notes, you say, oh, let's say you're taking it, you're a cancer patient and you're taking it for nausea. Oh, I can see that this thing that has 10 parts THC, 1 part CBD, every time I use it, it gets rid of my nausea. So you have that on hand, and it's very helpful to have those notes, and then you can really just build up, for lack of a better term, an armamentarium or a toolkit of different products for different needs that you have for the plant. So to go back, THC, of course, is the thing that everybody thinks of that gets you high. But again, the nice thing about the medical program is that you can get the other benefits of THC without getting high if you don't want to. And you really can control what effects you're getting. Again, it's also very good for reduction of nausea and vomiting. I get a number of patients from Sloan Kettering who are getting chemotherapy, and it's very helpful for them, because a lot of them do develop nausea, vomiting, they lose their appetite. And so those patients will come to me and they'll use something that is a THC predominant what's the word? You know what I'm saying. It's more THC than CBD. It's also a great pain reliever. It's as strong as opiates, which is, really helpful for people. It's also very good for muscle relaxation. I have a lot of patients who have multiple sclerosis, and for them, oftentimes muscle spasticity is one of the worst symptoms they have. And oftentimes they will take a high THC product and they can just feel that tightness go away. What's also interesting is because a lot of the patients I have chronic pain, so many people, if you think about it, when you're in a situation where you do have chronic pain, you're always holding yourself in certain ways to mitigate that pain, but you're then using your musculoskeletal system to maintain your balance or your stance in certain ways. And so muscle rigidity or tightness in those situations is also a component of the pain. And so the THC can help in that situation as well. We can go on to the next one. Okay, so now CBD. CBD, the major properties that CBD has are as an anti-inflammatory. We see a lot of patients who have autoimmune diseases where the inflammatory response is just an ongoing kind of situation or part of their disease process. And I saw very early on that the patients I had who had rheumatoid arthritis or lupus, so many of the autoimmune ankylosing spondylitis, things like that, were doing really, really well. And that's because of the CBD. We're also, I'm seeing patients. In fact, I was there today at a place called Inspire, that is a senior living facility on the Upper East Side. And a lot of the patients there have cognitive problems and related anxiety. I've started to realize that a lot of patients, as they are losing their memories and their cognitive abilities, understandably, they get very anxious and they start acting out. They don't have those frontal lobes anymore that are really would ordinarily inhibit them from aggressive behavior, even assaultive behavior. And we're having some incredible success giving patients there a high CBD ratio, so more CBD than THC. And several of them have now either stopped or significantly lowered their antipsychotic medicine, the benzodiazepines they're taking. So it's very good for that. It's also neuroprotective. And just for an example of that, I don't know if people have ever seen, there are a lot of things on YouTube, but one in particular that I would recommend is Sanjay Gupta has a 3-part series. He went from being a marijuana skeptic to being very supportive of it. And in that series, he actually shows some video of kids. There are kids who have Dravet syndrome and another syndrome where they have multiple seizures, up to 100 seizures a day, and they'll be put on all these different meds, none of which work very well. And you can see the kids, the parents giving them high CBD drops, and the seizures stop. They may stop for a week or more. There are also, we were working with Marvin Washington, who was a New York Jet, and he talked about the fact that a lot of the Jets before the games were using cannabis, number one, because it was really helpful for pain and they didn't want to be on narcotics. But number two, a lot of them, as we know, are prone to traumatic brain injury. And that's where those neuroprotective benefits come in with CBD. So those are some of the benefits from CBD. Let's go on to the next. The reason this works is because the endocannabinoid system, I'm sure people have heard of the endorphin system. That's why if you take an opiate, it goes to these opiate endorphin receptors in the brain, and you get the effects that you get. Interestingly, the endocannabinoid system has vastly more. It is the master system. It has the most, as I said here, the most extensive system of receptors in the body. But interestingly, in distinction to endorphins, the reason why when people overdose on opiates is what happens is they stop breathing, because in the very primitive parts of the brain, the part that is involved with respiration has many endorphin receptors, and you hit them and you stop breathing. There are no endocannabinoid receptors in that part of the brain. So one reason why people have no one's ever overdosed from cannabis. But again, it is involved with so many different systems. And I think that's why it works so well. I mean, again, I'll show you in a minute or two what the different conditions for which it is allowed, but there are so many different conditions. I don't know of any other substance that can work for pain, for memory, for GI symptoms, for pulmonary, cardiac, neuropathy. I didn't mention this, but I see a lot of patients from Sloan again who have chemo-induced neuropathy, and it can be very helpful in that situation as well, varying combinations of THC and CBD. So it's really, it's been a great learning experience for me, I have to say, and very gratifying, especially after all the years where I was an emergency doc. What I've been doing now is so gratifying. I have so many patients who will say to me, I'll do a typical, and this may be a good place to talk about this, when someone needs to or is interested in being certified, they'll come to me with their records to show whatever medical problem they have, and we will talk, and I will talk to them about, I'll take a good half hour or more to talk about all of the things I'm saying here, although I don't get into the history very much. And then they will go to a dispensary, and they'll work with a pharmacist, which is another great thing about the New York program, because you have to see a pharmacist before you get started. And especially when we're, in this situation, we have a lot of elderly people, they're on a lot of meds. So it's very, I feel very good. I mean, I'm obviously looking at any possible interactions, but I know that I have the backup as well of a pharmacist who's going to look at the different meds that a patient may be on, and then we'll have to really modify or take into account any kind of issues with the breakdown of those meds in conjunction with the cannabis system. Okay, let's move on. So, and then this is, and the thing that I was going to say though was that a lot of patients, after I've certified them, we will do a follow-up. I try to do a follow-up with everybody in about 6 weeks or so. And so many of them will say to me, Dr. Weinberg, this is amazing. This is a game changer. I wish I had known about this before, because it is so helpful without so many of the side effects that other drugs that they're taking will give them. So here are the different ways. There are a lot of different ways to take cannabis, medical cannabis. And I really look at them as in three different categories. One are the topicals. So these are like salves and ointments and things like that you can put on the skin. And some people do very, very well with that over an area, low back pain or joint pains of the knees or the elbows, whatever. They find that can be very helpful at alleviating the pain. And then the other two forms of ingestion, I think of as the slow acting and the fast acting. Fast acting are like vapes or joints, drops, sprays. They all will come on from anywhere within a couple of minutes to 15 or 20 minutes and can last several hours. So they're very helpful for, I have a patient who has very bad Crohn's disease, and when he gets a flare of that, he will vape actually a high THC product, and he knows within a couple of minutes his symptoms will be resolved. Then there are the longer acting products, and those are the ones that you ingest, whether it be capsules, powders, gummies, things like that. They can take up to an hour or more to come on because they have to be digested. But the great thing about that is they can last 6 or 8 hours. So people who have chronic problems, pain being a perfect example, will oftentimes take capsules in the morning, and then they can be pain-free for most of the day. Some people may have to take 2 a day. Again, you start at the lowest dose, the most infrequent amount, but some people, depending on how much pain they are, how they react to this, may need more. Okay, let's move on. So these are the conditions. What happened with New York State when the law went into effect? There were 10 conditions that our former governor allowed, and then as the program evolved and there was such a positive response, they added more and more conditions. What's happened now with the adult use going into effect, what New York State did, which I support 100%, is basically they've said, any condition that a practitioner thinks could be benefited by use of medical cannabis, they will allow. So when I do a certification of someone, it used to be I'd have to go to a drop-down menu and I'd say, oh, they have chronic pain or they have neuropathy or whatever. Now I just have an option of putting in dementia, for example. And that's great because it is so helpful for so many conditions. And I think the state was wise to not regulate it and let the practitioners really make their own decisions. Just if you go to the next slide, these are other states. These are the conditions that the other states, going across the 38, I think, states that have allowed medical cannabis to happen. Just to give you an idea, there are so many different conditions that they are allowing, and it works for so many of them. So I think, is that it, Lauren? Yes. So I am around. I'm happy to talk to people. Obviously, I will take questions now, but if you have any questions, that's our website. And Lauren, who is my helper here, major domo, et cetera, is always around to answer questions. And now I will answer questions.
Okay, we've got one question that's come in. Can I get a prescription for cannabis for arthritis from a doctor?
So the way it works is if you have to be registered as a cannabis doctor or practitioner, because not just MDs, now nurse practitioners, PAs, et cetera, can get registered, but you have to be a registered doctor, which means that you have to take a course. It's like a 2-hour course now. And once you do that and you register with the state, then that practitioner can certify you, but it's not a prescription, because remember, it's a Schedule I narcotic. So what actually happens is I write a recommendation, and then that goes to the pharmacist, and the pharmacist is actually prescribing whatever they get.
Okay, how valid are the street shops?
Not at all. There was an article in the Times a few months ago, which I think we have on our website, where they randomly went into, you're not talking about the registered legal places, but just the pop-ups, the local bodegas or whatever, where you can just go in and get weed. Is that what the question is?
Yes, yes.
Yeah, I wouldn't do it because an important thing to know about cannabis and hemp is that they are super accumulators, which means that they pull up all kinds of crap from the soil and from the air. In fact, the example that sticks in my mind is when the Chernobyl disaster occurred, they planted hemp there to draw up radiation from the soil. So the point is that when you go into a shop where there's no certificate of, what is it called, Lauren? COA. Anyway, materials of
Authenticity.
There's another word.
The certificate of analysis.
Analysis, thank you, COA. They will not give you a COA. So, not only are you not knowing what you get, because you'll go in there and say, oh yeah, this is an indica, 28%. This New York Times survey, they went in, oftentimes there was 50% or 0%. And it's not looking at the heavy metals or pesticides, bacteria, mold, all of those things that when you go into a medical dispensary, every batch has been looked at by the Department of Health. And so none of those things are in there. And again, as a physician, I'm really happy about that. The last thing I want is for somebody who I'm treating with, for a medical problem to be going in and getting heavy metals or, any of these other things. So.
Where can I find the listed registered providers?
The New York State, Lauren, what is where do they go?
So depending on what state you reside in, so for New York, for example, going to New York's medical cannabis program's website, but this varies for each state. But your state's Department of Health's website is the best place to find a list of providers that can certify you. And one of the ways in which you'll know that you are on the right site is that it will have a .gov in the web address.
Right, and in New York, specifically, when you get to that site, it goes by county. So depending on what county you're in, you can find a list of the practitioners in that county.
Someone's asking, how about for CBT? I'm not sure if they mean CBD.
What about?
Could you, I guess could you clarify, could you elaborate on your question? But I have a question meanwhile. If in fact you are starting this treatment later in life, either because you're undergoing chemotherapy or for some other reason, how long does it take to sort of figure out what the right dosage is for your, and is there any additional risk that someone who is older faces in using cannabis?
Yeah, I mean, I think cannabis, like all other drugs, I think all of us practitioners try to be very sensitive about the fact that metabolism changes, interactions with drugs change as you get older. And you always want to, again, start at the lowest possible dose. But the other part of your question is interesting because I'll just give you an example. And you and I had spoken about this before. I recently saw a patient who had a serious alcohol problem. She was drinking 2 to 3 bottles of wine a day, was very anxious. We started her on, it was actually equal amounts, 1-to-1 capsules. Within a day, her anxiety was resolving. It's now almost 3 months later. She may have 1 glass of wine a day. The anxiety's gone. She lost all that alcohol weight from her face. And so she, within a day, I mean, I was actually shocked at how quickly it worked for her. Some people, it can take weeks. And again, you really have to be patient about it because it's not one size fits all. We can't predict exactly what kind of ratios or amounts to use. Again, you're starting at the lowest dose, but I think people have to be very patient because there is a certain amount of trial and error. I would say, though, in the probably 1,300 or so patients I've seen, conservatively speaking, I would say 80% of the patients stay around. They find a spot, and I see them year to year. So it really does work for them. Is
there any precaution that needs to be taken regarding any other medications you may be on, or, to avoid any sort of interactions and that
yeah,
kind of thing?
there's a whole list of things, and we do this on an individual case-by-case basis. When I see patients, they'll have gotten their medical records, so I'll know what medicines they're on, and then we can talk about that. And again, when they go to the pharmacist is also involved in making sure that there aren't any interactions.
Are different states dramatically different in terms of what they will and won't allow as a medical condition? Or
that list that I showed showed I think more and more of the states, if I'm not mistaken, are going, at least several of them have gotten to the point where they say, like New York State has now gotten to, where any medical condition that a practitioner thinks would be benefited, they will give them carte blanche about that. But there are a number of states. There's some states that don't even allow it. I mean, it's very frustrating because some of the states are very restrictive. You can imagine a lot of red states, conservative states, are trying not to allow it to happen. And I was visiting my daughter in Georgia and went into a place. They have Delta 8, which is a whole other conversation, and CBD, but it's not regulated, so who knows what people are getting. I mean, that's the downside of a state where they're not allowing it, because people are using it, and you want to regulate it because you know that you're getting what you want to be getting, and none of those other toxins, et cetera, that are so readily available.
Is the testing of the medical grade cannabis reliable, in your opinion?
I think it is. I mean, it's mostly at the Wadsworth lab up in Albany, and I think it is reliable. There are also private companies that are doing it. I will say I had one doctor who is a toxicologist who was very skeptical, but most of my colleagues feel pretty comfortable with the fact that it is reliable.
Mm-hmm. Okay, I'm going to go back to the answer to the questions from the audience. I am 58 years old, going through menopause, and notice issues around focusing and anxiety, perhaps ADD, ADHD. Can I benefit from cannabis? And if so, which one?
Right. Well, and I'd say absolutely. Again, the anxiety is really helped by CBD. But it's a combination. I have a patient, I just spoke to the wife of a patient today who has dementia. And I'm not saying that this person has it, but he's getting a combination of THC and CBD, and he is more focused in addition to, not being anxious. And what I've discovered is that I think anxiety affects cognition also. I think any of us, when we're trying to recall a name or a fact or whatever, anxiety can prevent us from accessing that information. So I think it could help with focus. I will just give another example because these things have been so informative to me. I have a patient who has very, very bad back pain, and he takes a high THC product every morning because it really helps his back pain. And I said, well, how does that affect your cognitive abilities? Well, I'm a computer programmer, and I need every day, I'm faced with issues, with problems I need to solve in a particular program. And I find that the high THC gives me answers, gives me ideas and solutions that I wouldn't have thought of prior. And which reminds me, and I hate to ramble, but I'll just tell you, it just reminded me of something else. I had a patient who had Crohn's disease, who was a Hasidic Jew, and he was getting great benefits from a high THC product for his Crohn's. And on our follow-up visit, he said, can THC give you wisdom? And I said, oh, well, what do you mean? Well, I've been studying Torah for all of my life, and there are certain parts of Torah that I've never understood, but when I'm using cannabis, I understand them. And it's not that I'm high, because I spoke to my Rebbe about it. I spoke to my wife about it. So I just throw that out there.
Okay. Getting back to the earlier question about CBT, the individual was referencing cognitive behavioral therapy. So I guess what's the connection between CBT and
cannabis?
Cannabis.
You know, I've had a couple of patients who were using it, who are doing the CBT with cannabis. I don't know enough about it. I would be happy to have a conversation with this person about it. You know, I think I'm intrigued by it. I think it could be very helpful, but I don't know a lot about it.
Okay. What if I start to take too many products at once because I didn't think it was working and then get too high? Is there a way to get less high?
Well, it turns out that CBD, it will counteract the effects of THC. So that's often a good way of counteracting the effects. People will drink water, they'll go into a dark room. I think you have to have the mindset that it's going to go away. I've had a number of patients who've told me that exact scenario where they, especially with gummies, I mean, that's so well documented that people will take gummies and all of a sudden, because they won't get an effect in a half hour, they take more. I mean, I think the most important thing to keep in mind is that it will go away. You're not dying. And if you go in a dark room and you relax and you drink fluids, and if you have something with more CBD in it, oftentimes that will help it pass quicker.
Yeah, I believe you said earlier when we were talking that no one has ever died from a marijuana.
That we know of in 5,000 years.
Apart from just perhaps a car crash or something like that for being impaired, but not.
Yeah.
Yeah.
No, I acknowledge that can be an issue. Absolutely.
Okay. How do I store the products?
I think it needs to be in a cool, dark place.
Okay. Like a refrigerator or?
Or even on a shelf, but someplace where it's cool, because I think, the heat will definitely cause it to degrade quicker.
Okay. And how do I broach the conversation with my doctor?
Great question. I wish, 11% of medical schools teach about the endocannabinoid system. So there's a vast amount of ignorance among my colleagues. And I've had a number of situations with doctors where they were adamant they would not. I have one patient who had a terrible neuropathy. She saw that smoking a joint was really helpful, and she asked her doctor to send her records to me so that she could get medical cannabis, and he absolutely refused. And I said, you know what, do you have something that says you have neuropathy? Just send it to us. And I wound up certifying her. I mean, I hate to go around somebody. I think I'm always available. I try to be as collegial as possible, and I always encourage patients, if there are issues with their doctor, to have them contact me, because I think education is the most important thing. So I think going in with that an attitude and saying, I'm very interested, I understand it could work in my condition. Would you please talk to the doctor who, who would certify me? I think that they have to have a conversation, and I'm happy to be part of that conversation.
How about insurance companies? Are they reimbursing for cannabis, medical
Because it's a
cannabis?
Schedule I, that allows the insurance companies not to, certainly for the product. But, what we do often is, if somebody wants to see about being reimbursed for the visit, we will send them a bill with their diagnosis on it, which they can submit to their insurance companies for reimbursement. I don't take insurance. I work with another doctor, Dr. Carlton, who's a psychiatrist who takes Medicare. So he that's a way around it. But until it's descheduled, the insurance companies are not going to pay for it because they don't have to, and they don't want to, obviously.
And what's the going rate?
For a consult with me, or
No, for the cannabis.
how much, it really depends. I'd say the least amount that somebody would spend a month could be $60 to $100. I've had some patients who are spending several $100s a month on it. What the nice thing is that once you go to a dispensary, the dispensaries are always having sales. So you can, I have a lot of patients who will stock up on a sale and, that way be able to save money. But that's kind of the range, probably a median would be $200 a month, I would say, something like that.
Can individuals in assisted living facilities or who are hospital bound take this at those respective facilities?
It depends on the facility. I do research with Northwell. I'm a Northwell doc. I know that Northwell allows it. Northwell's the largest hospital system in the state, so that's good. But I think it's on an individual kind of basis. Some places will not.
Okay. If I want the spiritual experience, where would I go safely for a THC product?
Well, if there's no medical reason for doing it, then that person might be the one who would go to an adult use facility. I'm all in favor of medical, because somebody could come to me and I could give them I can certify them and they could go in. The dispensaries are really good. The pharmacists are very good. So it's an option to either go to a medical facility or try, there are a bunch of adult use facilities that are now popping up and they're registered by the state. I think they're legitimate. I went to one in Ithaca about a month or so ago. The people there were very knowledgeable. They were very specific about what products were available. They knew all the growers, they were local growers. So it was actually a very interesting and positive experience.
Okay. What about growing your own?
Great question. Did we put that up, Lauren? We had something on the website, or we were going to, because you now can grow your own. And I forget all the amounts you can get. I think it's up to 6 plants. If you're a provider, or, because there are caregivers, there are different amounts. But yes, absolutely, you can grow your own, either indoors or outdoors. Laura, you had asked me about this yesterday. I think this is one of the things that's probably keeping it illegal or scheduled. The drug companies obviously are not happy about something where you can get seeds and grow in your go to your garden and grow something that's going to give you all these benefits. It's not going to cost very much at all. They are certainly not happy about the benefits that someone could get from cannabis as opposed to a pharmaceutical.
And if I can just sort of add on to what Dr. Weinberg was saying there does seem to be a bit more of an incentive to obtain a medical cannabis certificate, at least as of now in the state of New York. And again, this will vary from each state that you're in. So you will need to check your state's Department of Health's website to see, but only medical cannabis patients are allowed to grow their own plants at home. So you know, if that is something that you're interested in, then a medical cannabis certificate does become a necessity at that point.
Very good point, Lauren. Thank you.
What is an adult use facility?
It's a place where, is it 18 or 21, Lauren? Do you know offhand? I mean, you have to be an
I believe
adult.
it's 21, yes.
Yeah, and you go in and you show your ID, and you know, but they have been set up by the state, and so I think the quality and of the ingredients and the specificity of the ingredients, like I said, you can go in, and I went to the place in Ithaca. Oh, this says, you know, 20% indica. It's this many milligrams of THC. They were very specific, and I think you can count on the fact that what they are telling you will be the real thing. I mean, this is all, it's all evolving, but you know, at least my experience in Ithaca was very positive.
Okay, we've got 7 more minutes with Dr. Weinberg. So does anyone have any questions they've been dying to ask and are just too shy, or has something struck you since we started this conversation, which I'm finding to be like a great way to wrap up a Friday afternoon, you know, and
What do you do after?
Dr. Weinberg, are there, you know, any last words that you have, or, you know, anything about, you know, like if you're with family members for whom it's still a stigma, is there any advice?
Yeah, you know, I think education is really the critical thing. It has been, as I think I alluded to, for me, a really exciting and gratifying experience over the last 7 or 8 years doing this. And I'm frustrated by the fact that the research is difficult to do because it's a Schedule I narcotic. You know, all of the things that go along with it being a Schedule I narcotic are really make it very frustrating, because I think there are so many possibilities. If you look at other countries, I have a friend who's a GI doctor in Israel. They're doing great research there. And Canada is doing great research. You know, there are so many benefits that I think we could be getting from it. And I'm hoping that Biden will deschedule it. It's funny because the states that voted for Trump in 2020, the majority of them also voted to legalize cannabis. So, you know, I think the politicians are behind the curve here. People in this country want to be able to access it. And I think it's been around for millennium. I think we've evolved with it. I think there are so many potential benefits that I encourage people to look into it, to talk to their friends, I'm sure everybody knows somebody who's using it, whether medical or not. And again, I'm available. I'm happy to talk to groups. Obviously, I really enjoy talking to people about it, whether it's individually or in a group. So I'm around to talk about it.
Great. Lauren just dropped your YouTube channel into the chat, which is great, because Lauren, I was also going to say, if you could either show us the slide again with the contact info, or drop that into the chat for where people could find your website, phone number and whatever, that would be fantastic. Because I believe you've got a lot of resources online that would also be of value to people based on, what we've been talking about this afternoon.
Yeah, we try to have as much information on the website as possible, as much up-to-date information.
Great. Okay, what's the most exciting thing you're working on in this area? That's my last question.
Dementia.
Mhm.
It turns out that cannabis can really help dementia. And not just the anxiety, the neuroprotective. It turns out that THC, a lot of the drugs that people with Parkinson's take work on a specific enzyme, acetylcholinesterase. Turns out that THC is really good at combating the effects of that. The fibrils, the neurofibrillary tangles that Alzheimer's patients have, THC can prevent the development of those. So I'm very excited. I think it's it's a field that is waiting to explode, cognitive issues and cannabis. And I'm very excited about that.
Fabulous. All right, someone's asking, I'm interested, how much is a visit at your clinic?
You know, ordinarily, I charge $300, but for anybody who's part of this group, I would say $250 for a visit. And if you just tell Lauren when, if you contact us that you were part of the group and you heard me talk, I'm happy to give a discount. I mean, we also do, we have a sliding scale because honestly, my feeling is I don't want the cost to be prohibitive. I don't want the cost to stop someone from being able to access this. So depending on, on income issues, we are very accommodating.
Okay.
So 300 is the top, but I've seen people for $50. I mean,
Okay.
I don't want to prevent people from being able to access it.
Make sure to pick up the contact info that Lauren has dropped into the chat if you're interested in following up. And I really would love to have you back for another deeper conversation about the whole cognitive issues and dementia aspects. For now, it's like our time is up. Thank you so much for your time, your knowledge, it really has been interesting. And thank you all for coming. You asked some great questions. Lauren, thank you for your help.